Throughout my own journey of finding out in college that I have hepatitis B, to pursuing my studies as a physician and then caring for those with hepatitis, and then coming out about my own diagnosis, and then now speaking out on behalf of those living with hepatitis around the world, I continue to be shocked by the lack of action in the fight against hepatitis. There are more than 350 million of us living with hepatitis, and one of us dies every 30 seconds as a consequence of hepatitis. The lack of commitment and financial support from national governments, global donors, development funds, policymakers, research, and healthcare institutions tells us that they have accepted these deaths which could have been avoided. We are being told that our lives aren't worth saving. We can't wait any longer for action, and it's time for change. The opportunity to eliminate a disease as a public health threat is rare, but for viral hepatitis, it is within our reach. With the vaccine and treatments against hepatitis B and the cures against hepatitis C, we can eliminate hepatitis by 2030. But we must work together and ensure that no one is left behind. The 350 million people living with hepatitis can't keep waiting. The 290 million of those who are yet to be diagnosed can't keep waiting to be tested and then linked to care. Those who need treatment can't keep waiting for access to life-saving treatment while their risk of liver cancer increases by the day. People who inject drugs can't wait for effective harm reduction programs. Pregnant women can't wait for testing and treatment. Their babies can't wait for the Hep B birth dose vaccination. We cannot give the next generation an epidemic which we could have prevented. Now is the time for the hepatitis community to speak in one voice and tell the world that hepatitis can't wait. We will no longer accept the excuses that have been given by governments and global funders who are turning a blind eye to the millions of deaths each year and the continued suffering of communities around the world. Hepatitis can't wait. I know that our hepatitis community will rise up and utilize every opportunity to raise awareness on July 28th. Even if the COVID-19 pandemic has hampered plans, I know that the power of the community is in our resilience and our determination to overcome adversity. World Hepatitis Day is our day. That as an amazingly diverse community from all walks of life all over the world, it is our day to tell the world about viral hepatitis. It is our day to tell the world that it is time to care about us, people living with and affected by viral hepatitis. We could be your family member, your loved one, your children, or we could be you yourself, and it is time to act. And as we reflect on the millions we have lost to hepatitis, we cannot let their deaths be in vain. This World Hepatitis Day 2021 must be a catalyst for global action. We need to grow the momentum, and we must eliminate hepatitis by 2030. Thank you again for your commitment, and I wish you all a highly successful World Hepatitis Day.